Hey guys, Dr. Physical Therapy Kyle White here. Today we're going to be talking about knee joint arthritis. If you're having knee joint arthritis, I want to start by saying I'm so sorry. I know it's a very painful ordeal. It can be very limiting in your daily life and affect you in ways that people can't understand. But today we're going to do some things to try to help you. We're going to try to reduce those symptoms. We can't just go in and carve out arthritis, but we can do things to help bring your pain down. We can improve your mobility. We can improve your strength and then increase your daily life to hopefully a level that you're satisfied with and help you get doing the things that you want to do. So if you're dealing with knee joint arthritis, your body and your knee is telling you that what you need to do is nothing. It's telling you that, hey, we need to shut it down. We need to just lay in the bed. That's the opposite of what you need to do. We need to get it moving. We need to improve mobility. Arthritis likes movement, believe it or not. A lot of times I'll have patients say that, wow, I actually feel better after the session. I thought it was going to be terrible. Well, no, it actually increases blood flow. So the first exercise we want to do is what we call a heel slide. And this is just getting your knee moving. We're kind of using that hamstring to help us bend that knee. All we're doing is bringing our heel up to our bottom, hence the heel slide. And we want to just go to a point where we're comfortable. We don't want to push through a ton of pain here. We don't want to leave you screaming and nagging at us. If you do get to a point where you feel some restriction, but you're not having a lot of pain, you can actually take that leg and kind of give it a little extra pull there and kind of push into some new range of motion, some new mobility. Let's try to do about 30 reps of this if we can. If you are getting to 20 reps and you just can't do any more than that, is perfectly fine. Let's move on to the next exercise. So anytime we have arthritis, inflammation, or swelling of any kind, what happens is what we like to call muscle inhibition. So it, in a sense, turns the muscle off. So our body knows there's something going on here. We need to shut it down. We need to protect ourselves. Well, to walk and to go up steps and to do everyday life, we need these muscles to be really strong. And also to take pressure off the joint, we need these muscles to be really strong. So one of the main muscles that gets inhibited is our big quad muscle on the front of our knee. I like to use a rolled up towel or anything that has a little give to it to kind of give us a tactile cue here. And all we're going to do is kind of push the back of our knee into whatever we have here and try to push it into the towel. And we want to see our quad kind of contract with this. And when we contract, we want to hold this contraction for about 5 seconds. We want to feel a good muscle burn. We want to do about 30 reps of this to kind of fatigue that muscle and to build some strength there. Let's move on to the next one. Next exercise is what we like to call a terminal knee extension. So we don't need this muscle just to work while we're laying on a mat doing, kind of relaxing. We need it to work while we're standing. We need it to work while we're going upstairs and downstairs. So this terminal knee extension allows us to work that quad in a more functional position that you would be in everyday life. And all we need is some form of resistance TheraBand of some sort. And we need that to be about knee level. And all we're doing with this is letting the band kind of pull us into knee flexion. And then we're going to pull it back straight. And we should feel our quad contracting with this. So kind of like the quad set, we want to kind of pull back. 5-second hold, really feel the burn there, and then come back forward. I want to try to do about 30 reps of this one as well. If you've got a desk or at work or anywhere, throughout the day, if you can find a resistance band of some sort, they sell them all over the place. They sell them at Amazon, Walmart. You can find these things hopefully somewhere close to you. And I would encourage you to do these multiple times throughout the day, especially if we're doing a lot of sitting, because this is going to kind of reverse that knee flexion, pull us into that good knee extension, and get that quad activated. The next exercise we're going to do is another quad strengthening exercise. You can have an ankle weight, or you can do this with no weight. Don't feel like you have to have a weight to do this and get some benefit from it. But if you get to where you're doing this with no weight and it gets to be too easy, by all means, find a weight. Find some form of resistance to kind of challenge yourself a little bit more. So we want to sit on the side of a bed where our feet are kind of off the ground. We want to kind of get our knee back, our knee forward to the bed. And all we're going to do is kick up straight. And we're going to try to hold that 1, 2, 3, 4, 5 at the top. Get that good squeeze in that quad and then back down. We want to try to do this for 30 reps, and that's going to really challenge that quad. Like we said, if you're having a lot of pain with this, don't do weight just yet. Kind of work your way to that. We're going to try to go for 30 reps. Let's move on to the next one. So a lot of you may have a love-hate relationship with this next exercise. You may love it because we're not really moving at the knee joint a lot here, but you may hate it because we're really challenging the hip. So a lot of times we underestimate the hip's influence on knee stability. Think about our knee, it's a hinge joint. It has some rotational components, but it's mostly going to move into flexion and extension. Now, whether that knee is kind of coming in, buckling in, or buckling out actually has more to do with what's going on at the hip. If our hips are weak, it can kind of increase the lateral stress through the knee joint. So we want to stabilize this hip. We want it to be as strong as possible. And the main muscle we want to target when we do that is actually the gluteus medius. So it's a muscle kind of on the lateral side of this hip, so the side of your hip. And the best way to target that is going to be to keep that knee straight, and then we're going to kick up to the ceiling. And now when you're doing this exercise, I don't want you throwing it up there and then flopping back down, throwing it up there, flopping back down. This muscle needs to be able to control that descent, because while we're walking, the main function of this muscle is to contract eccentrically, kind of prevent any hip collapse, and then secondarily to that, knee collapse. So with this exercise, we're going to keep a common theme here. We're going to go for 30 reps while we control that descent down. And if you're feeling it right here on the side of your hip and it's a burn, that's good. You're doing it right. If you're feeling it somewhere else, maybe check your form. Make sure you're all the way on your side. A lot of people will kind of come here and then they'll come up. You're going to get a lot of hip flexor with that. So make sure you're completely on your side there and then coming straight up. Kind of cue you can kind of try to point your toe down at the mat, and that'll kind of keep you on that side and keep you from trying to incorporate those hip flexors there. 30 reps. So I hope you found these exercises helpful. If you did, hit the like button for me. Really appreciate that. And if you feel led to do so, subscribe to the channel. We got a lot of great videos out there that might help you reduce your pain and get back to everyday life. We don't want this arthritis to hold us back. I know it's difficult. There's knee replacements and things out there that can help us, but sometimes we need to prolong our ability to go without that knee replacement. We need to make it a few more years before we get to that knee replacement. So let's not let pain limit us. Guys, that's going to wrap it up with Body Talk. My name is Kyle White. I'm a doctor of physical therapy. Please like and subscribe.